Yes, my name is Mona Bostic. I'm a registered dietitian and a certified MS specialist. I have been working with the MS community professionally for 7 years and living with relapsing remitting multiple sclerosis myself for 13 years. Registered dietitians are nutrition professionals who are trained in the science of how nutrients function in the body, but we're also trained to translate or communicate that often complex science language into practical solutions for healthy living and positive lifestyle changes. In addition to registered dietitians, there are many other types of practitioners who you might find working in nutrition out in your community. One example of this might be a health or a nutrition coach. The coaching process is similar to talk therapy in that it involves two people discussing ideas and issues, but it's different than the person who's being coached is in the driver's seat, meaning you, the person with MS, is in charge. But you work with your coach to create goals as well as strategies around how to achieve these goals. It's important for you to remember that each person who is a coach, they have a different knowledge base, a different educational background, and a different scope of practice. And as a consumer of these services, it's our responsibility, meaning you, the person with MS, it's your responsibility to understand what your needs are and how a practitioner might help to meet those needs. A dietitian can also help you understand the role of nutrition in the MS disease process and sort out fact from fiction regarding all of the MS diets. And then a dietitian can also help you regain the confidence you may have lost around your food choices because of all the conflicting information that's targeted towards you. And we can also help you to develop strategies to manage comorbid health conditions like type 2 diabetes, cardiovascular disease, hypertension, and others. All of these comorbid health conditions can be impacted with food choices along with other health promoting behaviors. And in addition to that, dietitians can help you to understand the role of nutrition and food choices in managing common MS symptoms, medication side effects, as well as develop strategies to address these problems in your own unique situation. I often interact with CAN-DO participants. One of the things that comes up most frequently is to talk about the role of nutrition in the MS disease process, and also the role of food choices in managing common MS symptoms. And then with that, we work together to develop strategies to reach personal nutrition-related goals. A few examples of the topics that I have worked with people on at a CAN-DO program they include meal planning, especially with meal planning can become difficult with cognitive challenges and navigating other common MS symptoms like fatigue and pain management. So developing a strategy to how to plan your meals and have them available for you so that you're less vulnerable to convenience foods, that's one of the important things that we can discuss. We also talk a lot about the role of food or food choices in managing some common MS symptoms, notably constipation, which is a very common problem in people with MS. So we address those specifics. As a person who lives with MS myself, and my background being in oncology nutrition prior to focusing on people with MS, I was very, very familiar with a vulnerable population, vulnerable to all of the conflicting and confusing nutrition information targeted at you. And when I decided to leave my job in a hospital setting for private practice, my own neurologist asked if she could refer her patients to me because so many people had questions about nutrition. They were confused. And it was at that point that I realized there was a need. There was a need to specifically address nutrition in a conventional way in the MS population. And that's what got me started in that way. That's what prompted me to focus my professional energy in that direction. And one of the things that I think has had the most significant impact on the people that I've worked with is coming to the understanding that eating well is not something that's different because you have multiple sclerosis. So when you eliminate that confusion right out of the box, you remove that from the problem. And then it's just because it is true that eating well is not different because of multiple sclerosis, but it can be made more difficult because of multiple sclerosis. Cognitive challenges, pain, fatigue, all sorts of other symptoms can get in the way of eating well with MS. But when you realize it's not something you have to do differently from your family or from your friends simply because you have MS, that takes a lot of the burden out of the way. You don't need to spend a lot of money on specific foods or supplements. You can eat well from a Food Lion or eat well from the grocery store near you, and that's perfectly fine, because there's a lot of things that go into our determining our health that have nothing to do with the grocery store that we shop at. What I would hope, if somebody was, say, newly diagnosed with multiple sclerosis, I would urge people to resist the urge to visit with Dr. Google, because Dr. Google seldom has your interest at heart. But I would also say that a registered dietitian is not as frequently included in the interdisciplinary healthcare team, and that you should request a referral to a dietitian to assess your nutrition status where you are right now, and to have that person as a resource for down the line. If you should, begin to encounter troubles or have questions, you'll have a reliable resource that you can turn to. And I say that as a conventional practitioner, there's a place for complementary, integrative, functional, add-on approaches to health, but you should stop first as your conventional, with your conventional providers, and make sure you're getting all of that stuff done first. Make sure your blood sugars are well managed and your blood fats are well managed and your hypertension is in where it should be. And then if you want to speak to somebody about a complementary approach as an add-on, as an addition, that is great, but don't skip that step in favor of, or in, something more alternative. I tell people honestly, the very best way you can eat well with MS is to not eat for MS. Because if you're eating well with MS and that has some obscure set of food rules and expensive ingredients that you find it difficult to comply with, then that's going to lead to problems. So you want to make sure your heart is in good working order and your brain is functioning well and you have good blood pressure and your blood sugar and everything else is in good working order. And that is because while there is no diet that has been shown to that has not been shown to have an impact on the MS disease course, having a comorbid health condition along with multiple sclerosis can and does negatively impact how well you live with MS. You can't, if you have poorly managed blood sugars or blood fats, hypertension, or other comorbid conditions that are not well managed, science would suggest you are more likely to go into a disability and have less than desirable health outcomes with multiple sclerosis. So if I could offer one takeaway when it comes to eating with multiple sclerosis, eat for health. And by doing that, you will be eating well for multiple sclerosis. There's an author and social commentator named Fran Lebowitz, and she once said that food is an important part of a balanced diet. I wholeheartedly agree. Your body prefers to get nutrients from food rather than supplements. But I would also add that balance, variety, and flexibility are equally important when it comes to having a balanced diet. Another phrase that I use a lot, eating well with multiple sclerosis is not black or white, it's 50 shades of gray. And it's all that in between stuff is where life happens. And so we want to make sure we stay in the gray.